Hi everyone, Dr. Sherry Ballantyne here again. Thanks so much for watching last time. It was really awesome to see how many of you tuned in to take a look from near and far. Hi everybody in Chicago, great to see you watching. So thanks so much for your subscriptions and keep watching for the great videos that we're going to bring you. So I wanted to tell a story today, a story that for us as osteopathic physicians is somewhat legendary in our training. For any of my patients or friends, family that have ever wondered, in addition to being a sports medicine doctor, I have two letters after my name, D.O., which actually stands for an osteopathic physician. So when we are in medical school, we have this very famous story that all of our professors tell us about how 100 years ago when we had the last flu pandemic, how osteopathic physicians figured out a way to help their patients survive the flu. How? So you hear this story over and over again when you're in medical school, and then lo and behold, here we are again 100 years later, and we're faced with another virus that can create a pneumonia. So lo and behold, the same story is true, and we have some extra techniques. What's interesting about this story, for those of you that have heard it before, what we're going to show you today are 5 things that you can do at home if you have COVID-19. These are things that will help you to mobilize the fluid. COVID-19 is excellent at creating a very, very bad viral pneumonia. For those of you that don't know what a viral pneumonia is when your lungs fill up with fluid. You shouldn't have fluid in your lungs. You should just have air. And so in this case, this particular virus is very good at creating fluid. What do we do when patients are sick? We have them lay down, like my wonderful helper here, in the hospital bed while we support you. Unfortunately, what we know is that that's not great, and we need to get people up and we need to get them to move. But what if you feel so bad and you're so short of breath that you can't get up and you can't move? So what's interesting about what we're going to show you today is the fact that in many ways these osteopathic techniques were the beginning of what we call in the hospital chest physical therapy. So when the respiratory therapist comes into the hospital and kind of works on your back and does massage therapy for you, what are they actually doing and why does it work? It works because of the fact that you have this large collection of fluid that's in your lungs, and what we want to do is mobilize that fluid. So for those of you that we want to make sure you don't have to go to the hospital. So when you start to get COVID, these are things that you can do that are lymphatic techniques. Your lymph is the sort of junk fluid that you make. It's filled with a bunch of junk that you don't need, so we want to filter it out. So today I'm going to show you 5 things that you can do that you can't hurt someone with, that you can help someone to get rid of that fluid and help get their lungs moving so that that fluid doesn't sit there and get worse and worse. Okay, you may still feel short of breath, but I guarantee you that if you kind of start doing some of these things, you'll feel a little bit of a transient difference. So we're going to start. My camera friend is going to point me down here so you can see what I'm doing. We're going to start at the feet of your patient. Your patient is lying just like this. You can, very, very simple. You can do this multiple times if you want to angle it just a little bit more. Thank you so much. So they start on their feet, really simple here. They don't have to have socks on. In fact, I would almost argue it would be better if they didn't have socks on. Nothing that would constrict them up here. You're trying to get the fluid. This is the reason why we pass out when we're at weddings. When we've stood for too long and our legs are locked, we want to get that fluid up to our heart, up to the filtrating system to get rid of it. So you're just going to start with a nice rhythm. This is called a lymphatic pump. For anyone that's been pregnant, you remember what it felt like to have your ankles be super swollen and your feet. I sure remember that myself. So this is a simple rhythm that you're creating. And you want to make sure that you're using your body weight to do it so that you're not just using your wrist, because then you give yourself a wrist tendonitis. But you're just going back, and as you watch on my patient, he's got this nice silhouette here of black that you can see this movement that we're creating. So you can do this for about a minute. Patients can also, that don't have a helper, if you're by yourself, go ahead and pump your feet up and down, just back and forth, just like that, nice and simple. That's it. That's called a lymphatic pump. So real easy technique to do. The next thing that we're going to do is, now we have moved the fluid from the feet, because you've been sitting watching Netflix or whatever it is you're doing, reading a wonderful book hopefully, and you're moving that fluid up. And so the next place that we're going to hit is the diaphragm, the abdominal diaphragm. Really important when you talk about a pneumonia. So everybody has to breathe. These patients, if you really are struggling at home and you're short of breath, you can still do this technique if you have to sit up a little bit and prop yourself up on pillows. What I'm finding with patients that have COVID right now is that they can't lay down flat because they can't breathe. So it's still okay. You can still do these techniques when you're laying a little bit with your pillows up so that you can breathe and aerate those lungs, what you have. So this one, these right here, you can feel where your floating ribs are. The front part of your ribs are here, the lower part of your thoracic cage where your ribs are. Floating ribs are down here. They're the last little ribs that you have. Person's hip bone right here. The easiest thing that you can do is divide and find their tummy button, and then the last part of where their ribs are right here. And if you imagine in your mind drawing the diaphragm right up and around here. So what you can do is with your patient, family member, friend, you're just going to help them with their breathing. So go ahead and take a nice big deep breath. He takes a big deep breath, hopefully a belly breath if he can. As he exhales, I'm going to kind of follow him a little bit. Just really help him with his breathing. Deep breath again. I'm going to follow him. And we're going to do this about 3 or 4 cycles is a good way to do it. And sometimes you can feel little gurgles and things like that. It may be hard for them. So you're helping them. And then what you're going to do after you've done this about 3 or 4 times is on the next and last inhalation, you're going to jump off like that. What you're doing with that is you're creating a temporary increase in their intrathoracic pressure, kind of almost like when you're scared and you go like that. You're making some space. You're getting that fluid moving. We don't want to see the diaphragm get into a place where it's in paralysis at all or not moving. We need that to move so that you can be moving that fluid. So we've moved the fluid from the feet. Now we're helping the diaphragm to move more. What we're going to do now is do a very famous osteopathic technique that, once again, we were told about in this famous story in school. It's a technique called rib raising, and easy to do. You can't hurt, none of this stuff you can hurt your patient with. I'm just going to show you the anatomy behind this. So this patient right here, if you can roll them comfortably, you can find right here where their spine is. These are the pokey parts, are your spinous process here. And you're just going to come right out here on what we call the rib angles. And once again, if most of the time we aren't dealing with patients that have pneumonia. So when you're talking about maybe a patient that's bigger than you, once again, it's important to use your body weight. I always tease you guys and say I've never lost a football player yet, right? And all I'm doing is I'm off of their spine. So this is where his bones are. I'm in all that nice meaty muscle that's because he's very muscular. And so I'm just going to pull him this way. And what I'm doing is these muscles that are right along his spine here, that are part of his thoracic cage, I'm just moving them for him. It feels good, but they might be a little bit sore. That fluid might be really congested in there. So that's one thing that you can do. If they can't tolerate this, same position. You're going to make your arms at 90 degrees. You're going to go underneath them and right here, and you're going to with your legs, you're going to move them up and down like this, and you're going to go along their whole spine like this. I'm trying to use good technique so I don't hurt my back as well, so I'm going up onto my toes. Little calf workout for the person that's doing this, and you're going to do this on both sides. All these techniques, if you want to do them for about a minute, it's great. So they get about a 5-minute treatment. That's great. Okay, now we've moved that fluid up. We're making things move. We're going to open him up in his, what we call suboccipital release. You want to move that camera down here. I have wonderful helpers, really professional. Right here, what you'll see, I'm going to make a ledge with my fingers, just like this. I'm going to find the back of his head, this bump that we all have. You can all feel it right now. I'm going to make this ledge right here. This feels good, okay? And I'm just going to go literally right underneath this, and he's just going to hang out. This is great for migraine patients too. If they've got the headache that is associated with the fever, this is something that can make them feel better as well. You can hang out here for 5-10 minutes. If you're by yourself and you're wondering how you can do these things, you can do the good old-fashioned 2 tennis balls in a sock, where you just let your head hang out on this. A lot of my patients, my concussion patients, know this technique. So you don't have to have someone to help you do some of the stuff on your own. If you want to mobilize this thoracic stuff that I was showing you with the rib raising, foam roller will do it too. You can put the foam roller vertical, you can put it horizontal and roll up and down. And you can even, if our patient here, he can even help himself and put his hands on his diaphragm and do that assisted breathing technique as well. So you can do all these things on your own if you're in isolation as well, okay? So you can do this several times a day, and once again, the objective is to help your patients breathe, because this particular disease process is really affecting their lungs. So 5 simple things you can do at home, old-fashioned osteopathic techniques that were tried and true, and now are very relevant again. Once again, subscribe. We're once again really happy to bring all these videos to you. And let us know if you have any questions or concerns, or certainly other videos you'd like to see us do too. I want to thank my crew. They've been wonderful help with all of these videos. Take care. Bye-bye.